Welcome to this explainer. Look, if you clicked on this, chances are you or someone you care about might be in the middle of a really frightening, incredibly painful situation right now. Today we're going to break down exactly what a kidney stone feels like, but more importantly, we're going to decode that sudden, intense pain so you know exactly when a simple home remedy just isn't going to cut it anymore and when you absolutely need to head to the emergency room.
So, have you ever felt a sharp, stabbing pain in your back or side that just will not quit? It's this unique, breathtaking kind of pain that honestly leaves people desperately searching for answers and, sometimes wondering if they're having a full-blown, life-threatening emergency. If you're worried you might be passing a kidney stone right now, I want to validate your distress. You are definitely not alone, and the pain you are feeling is very, very real.
Okay, let's establish exactly what we're actually dealing with here. Kidney stones are hard, solid deposits of minerals and salts, most commonly things like calcium oxalate or uric acid, and they form right inside your kidneys. They literally begin as these tiny, microscopic crystals that just gradually grow over time, especially when your urine gets super concentrated because, well, maybe you aren't drinking enough water. The real trouble starts when these solid little masses decide to pack their bags and travel down your urinary tract.
To give you a clear path forward, here is our agenda for this explainer. 1. Anatomy of stone pain. 2. The garden hose analogy. 3. Stones versus other pains. 4. Red flags and emergencies. And 5. Taking action.
Section 1. Anatomy of stone pain. Understanding the geography of your pain is really the very first step in figuring out what's going on. Kidney stone pain usually kicks off in the flank. That's that sensitive area on the side of your back right between your ribs and your hips. But it doesn't just stay there. As the stone moves, the pain migrates. It wraps around your side and shoots all the way down into your lower abdomen or groin. This is called renal colic, and it almost always hits in these intense, agonizing waves. You might even notice some secondary symptoms too, like a serious burning sensation when you urinate, or even visible blood, which can turn your urine pink, red, or brown.
Section 2. The garden hose analogy.
Think about your ureter for a second. That's the tube connecting your kidney to your bladder. It's basically like a narrow, flexible garden hose. And nature masterfully designed this hose to carry one thing: liquid. Now I want you to imagine trying to force a hard, jagged, crystalline rock right through that delicate, narrow hose. It's a complete mismatch, right?
So, the crazy part here is that the excruciating pain you're feeling, it isn't just the stone scratching you on its way down. The pain is actually the result of a mechanical blockage. When the stone stretches those ureter walls, urine backs up and pressure builds. In response, the smooth muscles of your ureter violently spasm as they desperately try to squeeze that blockage through. That spasm, that is the severe wave-like pain that quite literally brings grown adults to their knees.
Section 3. Stones versus other pains.
It is incredibly important to distinguish kidney stones from other dangerous abdominal issues, specifically appendicitis. The differences actually become pretty clear when you look at the location of the pain. Like we said, stone pain starts in the side or back and moves downward in sharp, intense waves. Appendicitis, on the other hand, almost always starts right near your belly button and steadily shifts to the lower right side of your abdomen. And appendicitis pain doesn't give you a break. It's just this steady ache that gets progressively worse over time.
But here's the real game changer when you're trying to figure it out: your physical reaction to the pain. Think about it. If you pull a muscle, lying flat and still usually helps, right? Not with a kidney stone. Medical professionals know that kidney stone patients are notoriously restless. You'll likely be pacing the room, shifting in your chair, basically writhing around trying to find a comfortable position, which, spoiler alert, is impossible. With appendicitis, though, movement, coughing, or even just walking makes the pain infinitely worse, so those patients strongly prefer to stay completely, perfectly still. Section 4. Red flags and emergencies. We are now entering the absolute most critical part of this explainer. Listen to this harrowing quote from Lisa Davis. She's a survivor who shared her story with the Sepsis Alliance. She was dealing with kidney stones, and she woke up at 3 a.m. literally unable to breathe. Her body was on fire with fever, which led to a frantic 911 call. This just shows how terrifyingly fast a blocked stone can escalate from a localized, annoying pain right into a massive, systemic emergency.
The ultimate danger we're talking about here is sepsis. If a stone completely blocks your ureter, all that urine backs up into the kidney.
Now, if bacteria happen to be present, this trapped pool of urine becomes a massive breeding ground for a severe kidney infection. That infection can quickly spill over into your bloodstream, triggering sepsis. It's an extreme, life-threatening immune response that starts damaging your own vital organs. Make no mistake about it, sepsis is a medical emergency that is just as urgent as a heart attack or a stroke.
Because of that huge risk, you absolutely must memorize these emergency red flags. If you experience a high fever, uncontrollable chills, persistent nausea and vomiting, pain that is just so severe you simply cannot manage it, sudden confusion or delirium, or a complete inability to urinate, you have to stop waiting it out. Seriously, do not try another home remedy. You need to head immediately to the nearest emergency room.
Section 5. Taking action and seeking care. So what actually happens when you seek professional medical help? Well, when you arrive at a clinic or a hospital, doctors aren't just going to guess what's wrong. They use really powerful tools to confirm it for sure. A non-contrast CT scan is basically the gold standard for locating a stone and figuring out its exact size and density. But if you're pregnant or just want to avoid the radiation, an ultrasound is a really excellent alternative. They'll also run urinalysis and blood tests just to check your overall kidney function and make sure there isn't some hidden infection lurking in the background.
Now, when they finally get those scan results back, there is one specific number they're looking closely at: 5 millimeters. That number is absolutely key. Research shows that stones under 5 millimeters actually have a very high chance of passing all on their own with just time, some pain management, and heavy hydration. But as stones get larger than 5 millimeters, the odds of them passing naturally drop off significantly. Those larger stones might actually require medical interventions, things like shockwave therapy to break them apart, or even surgical removal using thin scopes.
So, here is your actionable triage plan. Step 1. If your doctor clears you to pass the stone at home, you need to hydrate heavily to keep the urine flowing and flush your system out. Step 2. Always seek that initial medical evaluation so you aren't just flying blind. You really need to know the size of the stone you're dealing with. And step 3, vigilantly monitor yourself for any of those red flag symptoms we talked about, like a fever or an inability to urinate.
I'm going to leave you with this final, incredibly vital question. If something feels deeply wrong in your body today, are you prepared to stop waiting around and get checked? Remember, your health is paramount. Do not hesitate to consult your local physician or visit an emergency department for personalized medical advice if you're unsure. Thank you so much for joining me for this explainer today. Keep hydrating, listen closely to what your body is telling you, and please, take care of yourself.